Hi, I'm Dr. Ellen Gendler, a board-certified dermatologist in New York City and a clinical associate professor of dermatology at NYU Langone Medical Center. On this episode of The Doctor Is In, I'm going to try to tell you how not to feel bad about your neck, and that's pretty difficult. All of us will experience some laxity of the neck as we get older, some more than others. Are there things you can do to prevent it? Probably, but you probably need to start when you're 2 years old, doing things like complete sun protection and not smoking and other things that will help maintain the integrity of your skin. But once the skin starts to sag, it's really kind of a genetic thing. I don't believe in telling you not to move your head when you're looking at your computer because these are impossible things that you can't prevent. Bear in mind that if you look at your 11-year-old niece, you might see horizontal lines on her neck that she will not notice until she's 40, but they are there. We all age differently in our neck, and there are a few things that you can do to intervene. I don't really think that neck creams are terribly effective any more than just a facial moisturizer would be. But this really is going to be the test of time because every year there's new creams that are introduced that we don't really have experience yet seeing if someone uses them for 10 years. Is their neck different than it would have been if they hadn't been using them? There are some treatments that we use on women who have sagging or some crepiness of the neck that they don't like. The first thing we'll do is to do some Botox into the bands of the neck. Now, it sounds like a crazy thing to do, but there are muscles that run down your neck. It's called the platysma muscle. It's a very broad muscle, and over time, the action of pulling will cause the neck to come down, and as your skin is thinner, the skin will start to sag. So by putting small amounts of Botox or any of the other neurotoxins into this muscle, it can relax the muscle and help the neck look smoother. Is it a cure for the aging neck? It's not. Doing surgery will, quote, fix an aging neck. But remember that the moment you come out of surgery, it's like a car that you drive out of the lot. From the moment those sutures are placed, your skin starts to go back to the age that it actually is. So you will get some crepiness back over time. There are procedures that use ultrasound waves to heat the deeper tissues of the skin, and these can be safe procedures that do offer a moderate amount of help to women who have aging necks. But you need to be careful because with too much energy delivered, you can damage the deeper layers of skin and cause more atrophy and thinning than you had before you did them. I'm not someone who is a proponent of deep radiofrequency procedures with microneedling on the neck. I have seen people with bad complications. I've seen people with fat loss. I've seen people with irregularities in their neck after these procedures. And I'm very cautious to recommend these procedures to women as they get older. The thinner your skin is, the more careful you need to be with the damage that you do to it.